If you're over 60, your skin might be screaming that your kidneys are failing right now. Kidney disease often hides in silence, but those dry patches, the itch that won't go away, and those yellowing nails, they could be your body's final warning before your kidneys fail. Dr. Leslie Spry from the National Kidney Foundation confirms, the skin is a window to kidney function. That's exactly why I've made this video. I'm Vernon, and I've witnessed firsthand how seemingly harmless skin issues can quietly signal kidney failure years before it's diagnosed. Today, I'll reveal 7 dangerous skin signs that most seniors over 60 tragically overlook. Recent studies indicate nearly 40% of seniors unknowingly suffer from kidney disease. Don't let yourself become one of them. Stay until the end, and I'll share a simple 30-second home test that helps you assess your kidney health just by looking at your skin. Sign number 1. Severe itching. Pruritus. Itchy skin kidney disease, also called uremic pruritus, affects up to 80% of patients with advanced kidney failure. According to research published in the Journal of the American Academy of Dermatology, this isn't your ordinary itch. It's often described as deep, persistent, and sometimes unbearable. Dr. Jennifer Herman, dermatologist at the Cedars-Sinai Medical Group, explains, what distinguishes kidney-related itching from ordinary dry skin is its persistence and intensity. Patients often describe it as coming from within, rather than just on the surface. The itching typically affects large, symmetrical areas of the body, especially the back, abdomen, and arms. About 50 to 90% of patients on dialysis experience this symptom, making it a key indicator of kidney dysfunction. When to seek immediate medical attention: if itching is accompanied by yellow tint to your skin or eyes, unexplained weight loss, extreme fatigue, swelling in your legs and feet. Take a look at real-life insight. Before his 2005 kidney transplant, comedian George Lopez experienced months of severe itching, a symptom he dismissed as stress or dry skin. In reality, it was uremic pruritus, a common but overlooked sign of advanced kidney disease. Unlike ordinary dryness, itchy skin from kidney failure is deep, persistent, and often symmetrical. As Dr. Jennifer Herman of Cedars-Sinai explains, it feels like it's coming from within, not just on the surface. George's case highlights how itching, especially when paired with fatigue, swelling, or yellowing of the skin, can be a warning sign your kidneys are in trouble. Don't ignore it. Sign number 2. Dry, flaky skin. Robert, a 73-year-old retired accountant, struggled with persistent dry skin. Despite using expensive moisturizers, flaky patches on his back and abdomen worsened. During his annual checkup, his doctor recognized a symmetrical pattern and ordered kidney function tests. Revealing his kidneys were only at 45% capacity, his dry skin was actually an early kidney disease sign. Robert's experience highlights the well-established link between dry skin and kidney disease. According to Mayo Clinic, declining kidney function causes mineral and nutrient imbalances, severely affecting skin moisture. A 2020 study in the Journal of the American Society of Nephrology found 50 to 70% of stage 3-5 kidney disease patients suffer from persistent, treatment-resistant, dry, flaky skin. Kidney disease skin rash and dryness differ from ordinary dry skin by their symmetrical distribution, resistance to treatment, rough texture, and presence of a chalk-like residue. Common areas affected include the back, abdomen, and extremities. Prevention tips for kidney disease patients: avoid hot showers, choose fragrance-free soaps, and apply moisturizers while the skin is damp. Dr. Michael Shapiro, medical director at Vanguard Dermatology, advises using moisturizers with ceramides instead of those containing alcohol or heavy fragrances, alongside dry and flaky skin. In sign number 4, I'll reveal symptoms that appear in a part of the body most people over 60 tend to ignore, especially men. Sign number 3, skin discoloration. Eleanor, a 68-year-old grandmother, was puzzled when family members asked if she was feeling well because her skin looked off. Looking closer in the mirror, she noticed a yellowish tint, especially around her neck folds and under her arms. Her doctor ordered kidney tests, revealing moderate kidney disease that had gone undetected. When kidneys fail to filter waste properly, pigmented compounds called urochromes accumulate in the skin, causing a yellowish or grayish hue. A study in the American Journal of Kidney Diseases found approximately 40% of patients with chronic kidney disease experience these skin color changes. Dr. Amy McMichael, chair of dermatology at Wake Forest, explains, kidney-related discoloration has a distinct pattern. It often spares the eye area and appears more pronounced in skin creases. Simple at-home assessment. Examine your skin in natural daylight, especially around your neck, underarms, and inner thighs. Uniform darkening in these areas that doesn't match your normal tone may warrant a doctor's visit. Have you or a loved one experienced unusual skin color changes? What did you do about it? I'd love to hear your experiences in the comments. Sign number 4, half and half nails. Lindsay's nails. You've probably been waiting for sign number 4 because it's one of the most easily overlooked symptoms, like I told before, yet it appears in a part of the body most people over 60 tend to ignore, especially men. One of the most distinctive skin and nail symptoms of kidney disorders is a condition known as half and half nails, or Lindsay's nails. According to research published in the Journal of Clinical Investigation, this unique nail discoloration shows up in 15–40% of patients with chronic kidney disease. The base of the nail appears pale or white, while the top portion turns brown or reddish, a change that can be subtle but significant. Half and half nails appear as a distinctive two-tone pattern, pink at the bottom half and white or brownish at the top. This isn't merely cosmetic, it reflects impaired circulation and toxin buildup. As Dr. Richard Scher, professor of dermatology at Weill Cornell, explains, these nails feature a sharp demarcation line that doesn't grow out, making them a reliable diagnostic clue. Importantly, half and half nails may appear even before other kidney disease symptoms, serving as valuable early warning signs. When to seek medical attention. If you notice this nail pattern along with unusual fatigue, shortness of breath, decreased urination, mental fogginess. If these nail changes appear alongside other subtle symptoms, don't ignore them. Your body could be warning you about silent kidney damage before it's too late. Sign number 5, swelling, edema. Before we dive into one of the most common warning signs, let me share a true story that might sound all too familiar. Margaret, a 67-year-old retired teacher, was puzzled when her wedding ring suddenly wouldn't fit over her swollen fingers. She initially blamed arthritis, but when her shoes also became tight and her face appeared puffy every morning, her daughter insisted on a doctor's visit. Blood tests revealed kidney function at just 35%. Her body had been sending warning signals for months through this swelling. Kidney disease often causes fluid retention, resulting in swelling known as edema. The National Institute of Diabetes and Digestive and Kidney Diseases reports that this swelling typically affects the face, especially around the eyes, hands, and lower extremities. What makes kidney-related swelling different from other causes is its pattern and persistence. It's often worse in the morning, especially around the eyes, and improves throughout the day as gravity pulls fluid downward. According to Harvard Health, Approximately 30 to 40% of patients with nephrotic syndrome, a type of kidney disease, experience noticeable swelling as their first symptom. Actor Nick Cannon, who was diagnosed with lupus nephritis in 2012, has spoken about how facial swelling was one of his first noticeable symptoms. When to seek immediate medical attention. Appears suddenly and severely, is accompanied by shortness of breath, causes pain, only affects one side of the body, could indicate a blood clot. So, if swelling becomes a daily struggle, especially when it's persistent, asymmetric, or paired with other symptoms, don't dismiss it. Your kidneys may be sounding the alarm before things get worse. Get checked as soon as possible, before it's too late. Sign number 6. Uremic frost. James, an 82-year-old veteran, was rushed to the emergency room when his son noticed a strange white powder on his forehead and neck that wouldn't wash off. Doctors identified it as uremic frost, a rare skin sign of severe kidney failure. Blood tests revealed dangerously high urea levels. His kidneys were nearly non-functional, making immediate medical attention life-saving. Uremic frost occurs when urea crystals deposit on the skin in advanced kidney disease. According to Mayo Clinic proceedings, it appears as a white, powder-like coating primarily on the face, neck, and extremities. Dr. Jeffrey Callan, Chief of Dermatology at the University of Louisville, explains. Uremic frost is crystallized sweat containing urea and waste products, signaling critically high nitrogen waste levels due to failing kidneys. While rare today due to earlier intervention and dialysis availability, uremic frost remains a critical warning sign that requires immediate medical attention. If you or someone you know develops a white, powdery substance on the skin that can't be washed off, seek emergency medical care immediately. Sign number 7. Blisters and bullae. Advanced kidney disease can cause fluid-filled blisters called bullae to form on the skin. According to research in the Journal of Dermatological Science, these blisters typically appear on the extremities, especially the feet and hands. Dr. George McHale, nephrologist at the Cleveland Clinic, explains, these blisters result from a combination of fluid retention, toxin buildup, and microangiopathy, damage to small blood vessels that supply the skin. They're often painless but can rupture easily. A study in the American Journal of Kidney Diseases found that approximately 10 to 15% of patients with end-stage renal disease develop these characteristic blisters. They tend to heal slowly and may leave scarring or discoloration. When to seek medical attention: if blisters appear suddenly in multiple locations, are accompanied by fever or pain, show signs of infection, redness, warmth, pus, don't heal within 2 weeks. If you notice unexplained blisters, especially on your hands or feet, it's crucial to seek medical advice before complications arise. Conclusion: when to see a doctor and preventive measures. In summary, watch out for these 7 critical skin signs of kidney disease: severe itching, itchy skin kidney disease; extremely dry, flaky skin, dry skin kidney disease; yellowish or grayish discoloration; half and half nails, persistent swelling around eyes, hands, or feet; white powdery deposits, uremic frost, and unexplained blisters or bullae. Immediately contact your doctor if you're over 60, have diabetes, high blood pressure, family history of kidney issues, or use medications affecting kidneys. Prevention includes controlling blood pressure and diabetes, staying hydrated, reducing sodium, avoiding NSAIDs, regular kidney function tests, and using gentle skincare products. As Dr. Joseph Vassilotti from the National Kidney Foundation emphasizes, early detection significantly improves outcomes and may delay dialysis. I'm Vernon, And I sincerely hope this information helps you or your loved ones identify these crucial warning signs early. Remember, this video is intended for informational purposes only and should not replace professional medical advice. Always consult your healthcare provider for proper diagnosis and treatment. If you found this video valuable, please like, share, and subscribe for more senior health insights. Stay healthy and see you in the next video.